So I'm Linda Taylor, and I'm a physician assistant at Medical Associates, and we have some goodies for everyone outside if they'd like them. I do family practice, true family practice, but I also specialize in skin and dermatology. So I do a lot of skin procedures, and I do a lot of talking about how to take care of your skin and how your skin won't take care of you if you don't take care of it. So we're going to have a little fun talk today. We're going to talk about skin. What is skin? Well, there it is, supposedly. Supposedly it's an organ. Supposedly it can breathe and eat and live, and it dies and regenerates. It's got sweat glands that make sweat to cool us off, so it can keep us cool, it can make us hot, it can warm us up. The blood vessels in there can dilate and get us warm if it's cold out. It's got hairs coming out of it. It's got oil glands. There's little oil glands that make oil that comes out onto the skin and moisturizes our skin and protects us. It's quite complicated, really. It's got this fatty layer on the bottom there. And did you know that when you're very young, you have quite a thick fatty layer under your skin? That's our puppy fat that we say. And that as you get older, that fat layer gets thinner. And this is why, even if you're young or old, you bruise yourself the same amount, but when you're older, you can see the bruises better. Yeah. And it's because you've lost that fatty layer, which prevents you seeing them when you're younger. We kind of take skin for granted. It can be kind of just sort of there, you know, there it is. There's the skin. But it's really not really saran wrap, and it's not clothes, and it is a living, breathing actual organ. And wouldn't we look weird without some skin? So we know it's not a cover, really. It's not just a piece of clothing. It's not something we can remove and put back on. And it grows out of us, and it changes. You know that your skin regenerates. New skin is being made all the time. And what's happening to the old skin? Well, it's slowly sloughing off. And where does that go? It goes into the atmosphere. And you know all those little dust particles you see when the sun comes through? Did you know 90% of those are skin cells? So when you're breathing, you're actually breathing in and out other people's skin cells all day long. They're just lost to the environment. No, it's not. Hold your breath, hold your breath. Yes?
Does the coffee bean have any significance there?
No, it does not. I just thought that was a wonderful picture. I loved it. Can we fake skin? Can we make skin? No, I actually can't. They're trying, and maybe with stem cell therapy, they'll come up with some kind of growing skin. But basically, making skin is like trying to make a liver or a kidney. It is an organ, and it is really difficult to make. However, saying that, you can take a little inch of skin off a person, you can stretch it to 50 times its normal size, and it will look like a loosely knit lace sweater. And you can lay that down on a burn, and immediately it will start filling in with new skin. So a little inch of skin can cover 50 times its own size on a burn victim. So it's an amazing ability to regenerate. So it is a bunch of cells, and they do regenerate. And what the cells are little round spheres. And the cells that are on the surface of the skin are called epithelial cells, and they look like rugby balls. They're kind of round, they're sort of a bit oval shaped, and they've got the little nucleus in the middle. And those skin cells are all over the outside of your body, even your eye. The outside of your eye is skin. And then they go all the way through your GI tract, because we're a donut. When we're a fetus in utero, we actually look like a donut. And all those the cells on the inside and the outside of the donut are all epithelial cells. And then slowly that donut gets elongated, and the inside of the donut becomes the GI tract all the way through, and the outside is what you see. And so you have the same cells all the way through your body. There's skin cells all the way through your GI tract. This is why you can get skin tags or polyps inside your colon, just like you can get skin tags on the outside of your skin, because it's made of the same material. It's all skin cells. There's some skin. That's a lizard skin. So we know skin comes in all different shapes and forms, and we know it changes with time. It can be thick, it can be thin. There's the thinnest skin of your body right across your eye. That's what that looks like up close. There's alligator skin. That's really, really thick. And we look in the mirror and we see skin, and it's just this sort of pale pink sort of thing in the mirror. But when we look real close, it's actually really interesting. There's lots of ridges and cracks, and there's little hairs and glands and all these things going on underneath. Oh, baby skin. So we all start with baby skin, and that's soft and smooth. And then as we get older, our skin changes. And our skin is what gives us a lot of personality. You get personality from your eyes, but think about it. A lot of your personality is from what your skin is like. And if you smile a lot, you're going to get smiley lines, and that's going to change your face from someone that frowns a lot. Or like this chap, he smoked a lot, right? So he's spent 40 years puckering his lips, so he's got the little lines from puckering. If you sleep on one side only, you'll get lots of little lines on that side of your face and none on the other. And I can tell people sometimes when they come to see me, I'll say, you sleep on your left side all the time. And they're like, how do you know that? I've also had, I had a very interesting patient. He was a truck driver, and he came in, he'd spent his life driving a truck. And you could put a line down the middle of his face, and on one side, he looked to be about 30, 35 years old. And on the other side, he looked like he was 90. And that was just from ultraviolet hitting that side of his face from driving. Amazing. He made it into the book. We have the book. It's really elastic. I already told you how elastic it can be. You can stretch it 50 times its own size. Really elastic. And some people have got more elasticity in their skin than others. That's the other thing we know about skin is your genes play a big role in skin. How much it stretches and how often and how much it will react to the sun and ultraviolet. Of course, darker skinned people have more protection from the ultraviolet than lighter skin. And it can change. It can change suddenly. This is why people can go get these skin peels. You can literally take layers and layers of dead skin off your skin, and it will actually look lighter and paler. You can use creams. There's lightening creams now that work very quickly. They'll actually change the color of your skin. We've all seen, remember Michael Jackson with his vitiligo, and he actually did have vitiligo, and it can actually turn you several shades lighter. And no matter how fair you are, if you live in a high ultraviolet climate, your skin will start to change and become darker. So it can change. It can change quickly. It can change really quickly. It can burn. It does not like ultraviolet. And this is not a friend of our skin. So ultraviolet as in sunlight, but also ultraviolet as in these kind of lights that we have up here. You know, the lights that we use in the hospital, the big fluorescent lights, these will damage your skin. They will age your skin. They will burn your skin. They will cause more skin cancers. So staying out of the ultraviolet light or protecting yourself from it to some degree. There's a lot of people say that we can tan. It is true if you tan slowly and gently, that's less risky than suddenly burning yourself in the sun, but still more of a risk than if you lived in England in the clouds. The more ultraviolet when you're younger. So if you get burned as a baby, your risk for melanoma and skin cancers goes up 50 times the normal risk. So keeping your kids out of the sun and protected, especially when they're very, very young, makes a huge difference. We've all seen people, and we all get them. We get what I call the barnacles on your skin. And these are usually from damage you had when you were very, very young. Not from later in life, but damage from being burned when you were very young. You can stain the skin. This is amazing to me. You can put stains in it, and any color. It'll take up any color. And then, even though we know the skin regenerates itself, this stain will last forever. That's amazing to me. Amazing. We've all had some of this, right? The skin can get cross with you. But this is a dried out skin, like dirt. It dries out, gets cracked. You get deep fissures. These can get infected. But what I love about this is I can take a foot like this, and with some care and attention and the right kind of medications and the right oils and the right lubricants, this can heal completely and get completely better. There's not many organs can do that can completely heal themselves, regrow themselves. Your liver can. The liver can actually regenerate. But outside of the liver, not much, just the skin. It can be any color. You can be born any color, with any color skin, but it can change with time, and you can change your genes with time. If you live in a high ultraviolet climate, as your family progresses, children, grandchildren, great-grandchildren, their skin will slowly darken, and that's a genetic change. Oh, you can peel it, and this is what we ladies love to do, and all that peeling is taking off all the dead layers of skin. When you have a blemish on your skin, a dark spot, that's just extra layers of skin. And so all the programs that you hear about, the burning, the laser, the abrasion therapies, the chemical peels, all they're doing is taking off all the dead skin. And when you take off the layers of dead skin, the blemishes disappear, and some of the ridges in the skin also flatten out, because those ridges are caused by buildup of skin in different places. So it actually makes your skin look younger to take off the dead layers. And there are ever thousands of products out there to do this, right? All the Retin-A's and all the rocks and all the retinol creams and the AHA creams and the acid creams. That's what these all propose to do. The best bang for your buck, if you really, really want to peel your skin properly without getting a procedure done, you want to get Retin-A. And Retin-A is the only thing that really, really does do this. All the rest are a waste of money. This is what happens to your skin when it gets dried out and it gets too much sun. It starts to let you know that something's going wrong. It starts to get red and gets flaky. And this is skin bubbling up. This is a skin tag, right? And this is actually a genetic disorder. And this is really interesting because this is actually a problem with your DNA. If you get skin tags, this is an upset in one of the stop-gap DNA molecules in your cells. And what happens is normally when two skin cells come together, they have a reminder in the DNA to stop growing now, so form a blanket. But some people have a mix-up in the DNA and that stop-gap's not there, and the skin will come together and it will keep growing and it will make a bubble. Like that. And that is a skin tumor, but they're benign. They're called skin tags, and they're completely benign. But the same process is what causes cancer. So there is a link between these and cancer, whereas these are always benign, cancers continue to grow and metastasize. These will not. So they're studying that to see what the link is there. I think that's rather interesting. This is also polyps in the colon. So people that have a lot of skin tags often have polyps in their colon too. your skin will let you know if something's wrong. If you get a bug bite or get bugs into the skin, this is a burrow of a scabies down on the left there, your skin will let you know if it's got something wrong with it. You've got to take care of your skin. You've got to feed it. It's hungry. It likes moisture. It likes good food. Likes to be touched. Isn't that cute picture? Your skin likes to be touched. The skin reacts to touch. You have more nerves around the skin around your eyes than anywhere else in the body. Your eye will twitch from a puff of wind passing over it. And that's not your nerves, that's your skin reacting. The least amount of nerves in your skin is actually on your back. So I could poke you on your back and you couldn't tell me within about a 5-inch square where I was poking you. But if I was to poke you around your eye, you could tell me exactly within a millimeter where I was poking you. So there's different amounts of nerves in different parts of the skin. Don't burn. Don't burn your skin. That ultraviolet is so bad. Moisturize your skin, keep it, take care of it, or it'll start to do this. This is sun damage. And this is general sun damage. You can see that the texture of the skin is sort of more thinner and papery, kind of ridged. It's starting to turn red, and he's actually getting a precancerous spot here. This would be considered an actinic keratosis. And these are usually, they act like a zit that won't go away. Sort of it's red and rough and itchy and scabby, and it just never goes away. And that's a warning that the skin is starting to change. Ultraviolet destroys the genes, that destroys the stop gaps more, it keeps growing and it starts to form into precancerous cells. This is very precancerous. But these can be just frozen off or scraped off. The worst that these can turn into is basal cells, and those again can be just cut out or frozen or scraped off. Basal cell carcinomas do not metastasize, but they can make a mess locally. Here's some more. These are benign tumors. Again, benign. That means they're not going to turn to cancer. Now these are very crusty, rough. They're called cutaneous horns. They're not soft and squishy like the other skin tags, and these you do have to keep an eye on. Sometimes these can get red at the base and turn into precancerous areas. These just need to be frozen off. Now this is a squamous cell carcinoma. So this is the skin saying, right, we've lost the ability to take care of ourselves. We're just sort of going to disintegrate. And squamous cell carcinomas, they're like a wound, like a burn area that won't get better. It just won't heal. And these will spread, and they'll spread under the skin. They'll spread locally. If you've got one of these on your face, it can get into your jaw, up into your ear, up into your forehead. So they spread locally, and they're pretty aggressive, but usually can be removed. These are precancerous. And if there's no other slide that you take home with you in your mind except this one, take this one with you. This is melanoma. Now, melanoma is genetic. We now know you have to have the gene for melanoma. And then you've got to have the triggers. One of the triggers is ultraviolet. You've got the gene for melanoma, you get lots of ultraviolet. There's still another trigger, and we're not sure what it is. One of the theories is that it's an insult to your immune system, such as the flu, a bad virus. So you get a bad viral infection, it lowers your immune system, and the combination of the genetic disorder plus a lot of ultraviolet, you can end up with a freckle. It's usually flat. It usually stays flat, doesn't usually bubble up, although this one has a bit. But a freckle that becomes asymmetric, irregular bordered, multicolored, and starts to get bigger. This is only a centimeter, and this is deadly. This will have metastasized already. And that's radical surgery, chemotherapy, and very low survival rate. So watch out for these. So let's not get those. Let's protect our skin. lots of creams, moisturizers, sunblocks. That I like that picture because it looks like I'm blocking the sun with the moisture. Anyway, all right. Protect, protect, protect the skin. Take good care of it, pamper the skin. Things like peels and Retin-A and things like that are good for the skin. They prevent cancers, prevent them. Cover, protect. And by the way, that's a real snail. Look at that. That's the hugest snail I've ever seen. And if you take care of your skin and you love your skin, it'll love you back. And that's it for today.
Thank you.
Now then, any questions, ladies? Anything you want to know about? Yes.
If you had acne as a child,
Yes.
is there anything you can do later on to get rid of this?
The scarring?
the
Yes.
scarring?
Yes. Scarring is mostly usually where the skin cells at the base have been damaged, so they contract and they get tight, so you get sort of a dimpling in effect with acne. And yes, Retin-A is really good for that. Again, it removes all the dead layers and it makes it look flatter on the skin. And acne is very much dependent on hormone levels. So this is why teenage boys get a lot of acne, and girls, because their testosterone levels come up through puberty. And the higher your testosterone, the more acne you will get. And this is why we get acne when we go through menopause, because our estrogen drops during menopause and our testosterone comes up, and we end up with acne again at age 50, and it really makes you cross. It's like, it's not fair, is it? And that's a testosterone effect. And so in some young people with really bad acne, there's some trials now going on of giving them estrogen to lower their testosterone. Mostly in girls, you can't really do it in guys. And obviously going on the birth control pill has always been shown to help with acne. And that's why, because it increases your estrogen. And the higher estrogen, the less acne. Yeah. But scars can be fixed a lot. Laser therapy works on those, peeling, and Retin-A.
Retin-A is in the cream that you use?
Retin-A is actually a prescription cream. They have mild versions of it in some of the over-the-counter creams, but you'll pay out the nose for those. Anything with retinol has a very low dose version of Retin-A. But they do help, even though the counter ones can help. But you got to look for the retinol. Yeah.
So how are you different from a dermatologist?
Oh, because I don't specialize. I'm a mid-level, so I do all the dermatology stuff. I can do all of the procedures and everything. I take off basal cells, squamous cells. I do all of that. But I'm not a specialist. So if it's something more complicated or something that I'm not sure what it is, you'll still need to see the specialist. And I do that. I'll send you off if I think it's something worrisome. Anything else? We're good? Yeah? Thank you, ladies. Oh, bye, Molly. Yeah? Over the counter, you don't have to spend a lot of money. The best cleanser in the world is Cetaphil. Cetaphil, C-E-T-A, Ceta, and then Phil, like the name, P-H-I-L. Cetaphil, and it's cheap, and it's soft, it's gentle, and the best way to clean your face is with your own skin. Skin to skin, you cannot damage your face. If you use washcloths or buff puffs, you're going to damage your skin, it's going to get irritated, it's going to get bumpy. So you must only ever use your own fingers and a nice gentle cleanser. No soap. No soap. Moisturizer, I don't care what you use during the day, it can be anything, but it needs to have SPF, at least 15. That's the most, and even if you're inside, I get people that say, well, I only ever stay inside, I put sunblock when I go outside. If you're inside under fluorescent lights, you're damaging your skin. So you must wear sunblock even inside. Yeah? And then a nighttime cream, if it's got a little retinol in it, it is worth the money. Or you can get a prescription for Retin-A. And if you do... Oh, now you've asked. Olive Olay's got one. It's in its nighttime cream. Revlon has a one, and ROC, R-O-C, that has a retinol in it. But they're like $20 for a little thing. No soap. Don't use soap. Here, it will dry out your skin and irritate it. It will. You must have a soft cleanser.
Cetaphil.
Cetaphil's the best.
It is.
Cheapest, best.
That is a cleanser.
Yeah.
It's okay.
And a moisturizer for nighttime, if you don't need SPF, good old Eucerin.
Where can you
Eucerin or
get-
Lubriderm are
Where
excellent.
can you get that?
You can get, well, Eucerin, Lubriderm are over the counter.
Yeah.
Rock, all the retinols are over the counter. If you want to do Retin-A, you have to see someone like me and we can prescribe it.
Yeah.
And then Cetaphil's over the counter. So you don't need to spend a lot of money to actually have good skin.
And is the Cetaphil just for your face then? or-
Just for washing.
But
it's-
just your face,
Yeah.
not a body wash?
No,
Yeah.
no, just your face. Yeah, and your neck. Don't forget your neck.
Well, I used to hear that the skin is a organ. In other words, your face skin is really the same as your leg skin. So if you're using soap on the rest of your body,
Oh, exactly. Yeah, I would not be soaping your body ever. I would always use like a body wash, a soft. Dove
oh,
is fantastic.
not the bar soap though. And not even the soap that the native organic soap that's made of probably old-fashioned lard or something.
Yeah. Well, it's still a form of soap. I mean, you can try it yourself, and see the difference. But I think you'd notice the difference if you use like a soft moisturizing soap. I don't know about all the native soaps, but I can tell you soap, if it says soap, it's not good.
The prescription for Retin-A, how much is that?
Well, it depends on your insurance. Some insurance companies will pay for
If
it.
they don't.
Walmart has it for about $40. Up here it can be $50, $60. But a tube of that can last you 2-3 months. So if you think about it over time and what you might spend for a really good nighttime cream, they're $18 to $20 each for a little thing. It can work out about the same as the over-the-counter. But it's good bang for the buck, I can tell you.
Retin-A.
Retin-A, it will take, I will guarantee that if you use it for a year to 2 years, your skin will look 10 years younger. But it's a commitment. You got to stay with it.
I should
What
have
is
been
the
in
commitment?
Yeah.
You gotta just use it. You always use it. Use it every night or every other night, sometimes every third night. And when you first start to use it, your skin will peel. So you got to get through that first part where your skin's dry and peely, and eventually all that dead skin will come off. And then the Retin-A will prevent dead skin coming back. It'll prevent it rebuilding, which also helps prevent precancerous spots too. If ever you've had a skin cancer on your face, we can usually get Retin-A paid for.
So I'm not very good about putting night cream on. Am I just hurting myself?
I would. The more moisture, the better. Even if it's just Eucerin, slap it on. And a lot of people think if you use moisturizer, you're going to get more spots or more acne. That's not true. If you don't moisturize your skin will start to make more sebum, more oil, to try and moisturize itself. And when that happens, you get more spots, more acne. So these kids, and they're all drying out their skin, and they're not putting any moisturizers on because they're worried that they're going to get acne. I say, you must moisturize. The moisturizers for acne should say non-comedogenic. That means they don't plug your pores. And Eucerin is non-comedogenic, so is Lubriderm.